Good morning, friend. Myself, Dr. Atul, and today is our module's last lecture. And during these lectures, we will study about the treatment part of various injuries which we had studied during these lectures. So, and it is same. The treatment part for every body, every injury remains same. The open injuries which occur during the ground, like abrasion or any kind of open wound, remain the same. You have to wash under running tap water, and when the dirt is clean and blood is not oozing, then you can apply local uh, betadine lotion, oblique, any muprocin ointment or any antibiotic ointment, and you have to cover it with the bandages. Then, in the closed injuries like sprain, strain, closed fracture, you have to apply, you have to follow certain rules. That is initial management. Earlier, it is rice, then it's changed to price, and now the recommendation is polish. As the mnemonics self-explanatory, it is rice, that is rest, icing, compression, and elevation. Mean you have to give rest to that affected body part, apply ice for at least 20 minutes, not directly, put some cotton cloth over the injured part and then apply ice. It Why this don't apply ice directly over skin? It may cause further injuries, cold burn injuries also, and the compression will reduce the swelling of that affected part, elevation and compression. Then comes the price protection. Protection means you have to protect that particular area of your injured body part and by giving some rest, and then remaining portion is same like icing, compression and elevation. Protection means you have to use some uh, external splint or something which give provide protection to the injured part. Then comes the latest version is polish. In this protection, then optimum loading, icing, compression, and elevation. In this, by the meaning of protection is protecting that injured part from any kind of movement initially, and as after swelling got reduced, then gives that body part as a optimum loading, and simultaneously icing and compression remain same. So whenever you are on field and you see some patient or you yourself got injured, so don't apply any kind of warm, don't move your body part unnecessary, because it might hurt other or the injury got worsens. I have seen so many patients when uh, they come, they give history. uh, I hurt myself in the ground, and one of my colleague just uh, give unnatural movement to the joint to fix it, the dislocation, and now I'm unable to move my fingers, and I am in lot of pain. So it's better put that body part in the rest, use some locally available splint, apply ice if uh, permit things allowed you, then keep that body part elevated, and if you have some compression clothings or compressive bandages, apply compressive bandages. And keep one more thing in mind while giving compression bandage: keep your own one finger below that compressive bandage, so that it doesn't occlude your artery or vein, your patient's blood flow. So this is the primary management of any closed injuries like a sprain, a strain, uh, any kind of tear or closed fracture. And the treatment part will be provided in the hospital. If the fracture has occurred, so it will be done in the hospital or the medical team. And if some suture or suturing is required, then suturing is also be done at in the hospital. And when you are planning for his rehabilitation, so certain points you have to keep in your mind initially when the patient is pain free, and then you start your rehabilitation. That is, first pain free passive range of motion, then pain free active range of motion, isometric strengthening, isotonic strengthening, proprioceptive training, and in the last, game specific drills. So, rehabilitation of that particular patient is quite systematic and scientific approach. It is not random कि you can today do isometric strengthening, tomorrow you do game specific drill. It's not like that. It's a complete sequence and it has to be done under a close supervision of the specialist. And uh, initial and as soon as the patient is pain free and the medical team has allowed him for the joint movement, so first one has to start with passive range of motion, then progress to active range of motion. Passive range of motion means when somebody is moving his or that joint, patient is not on his will is moving that joint. When patient is moving his joint is active movement. And the isometric strengthening, when patient or you yourself without moving your joint is tighten up or make your muscles tight, that is isometric strengthening. Isotonic, that is all the when weight remain fixed and the joint or the muscles which causes that movement is lifting or doing that movement under certain weight is known as isotonic strengthening. And after that or simultaneously when isotonic isometric, then proprioceptive training also start. Proprioceptive means your joint position sense. That means you are balancing. When you are close your eye, you are aware of my which joint is in which space. And in the last, game specific drills. So these are the rehabilitation strategy under which one has to do his rehabilitation. So now we will go back to our module 1, and now I summarize from the beginning. For the upper limb and lower limb, in anatomy, upper limb consists of scapula, clavicle, our humerus, that is our arm bone, then radius, ulna, our forearm bones, our wrist bones, carpal bones. There are 8 in numbers arranged in 2 rows: scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate. And metacarpals and phalanges. Our thumb has only 2 phalanges. And the head of the metacarpal makes our knuckles. The muscles around the scapulas are periscapular muscles, rhomboidus major, rhomboidus minor, teres major, teres minor, supraspinatus, infraspinatus, subscapularis, serratus anterior, trapezius, sternocleidomastoid, deltoid, triceps, biceps, common flexors of forearms, common extensors of forearm, and muscles of the palm. Joints, shoulder joint, all movements, flexion, extension, abduction, adduction, horizontal abduction, horizontal adduction, elbow, only two movement, joint, flexion and extension, and radial ulnar joint, it's supination and pronation, wrist joint, adduction, abduction, flexion, extension, and circumduction. Femur is the long bone of our lower limb. It is the largest bone and bone of thigh. Tibia and fibula, the calf muscles, calf bone. Tibia is medial bone and fibula is lateral bone. Tibula gives origin to the anterior cruciate ligament and posterior cruciate ligament, and it holds the menisci. Then the tarsal bone, they are talus, calcaneus, which is heel bone, navicular, cuneiform. They are three in numbers: medial, intermediate, and lateral, cuneiform, and cuboid. And metatarsal and phalanges, same as thumb. Great toe also has only two fingers, two phalanges. And great toe, heel, and little toe uh, play important part in weight bearing. Muscles are quadriceps muscles, hamstring muscle, gluteal muscles, iliopsoas and rectus femoris, and adductor muscles. Tibialis anterior, tibialis posterior muscles, peroneus longus and peroneus brevis, gastrosoleus. They are two muscles, gastrocnemius and soleus. They are also known as heart of our second heart of our body. And in the lower limb, hip joint do flexion, extension, adduction, abduction, internal and external rotation. Knee joint, in a normal movement is flexion and extension. When knee is little bit flex, then medial and lateral rotation. At ankle, dorsiflexion, plantarflexion, inversion, and eversion. And on the phalanges, flexion and extension. Common injuries are abrasion, that is disruption of skin, sprain, injury of ligament, strain and contusion, injury of muscles, dislocation and subluxation. Dislocation is disruption of joint, and subluxation is partial disruption of joint. Fracture, discontinuity of bone. That is rotator cuff tear is a common injury of upper limb. It's a shoulder injury. A patient comes with pain, swell, may or may not be swelling, and he is unable to lift his hand above the shoulder, and sometimes he complains of impingement, like he says something is coming in between my shoulder, something is squeezing my shoulder muscles, or he complains like that. In tennis elbow, it's a lateral side pain at the elbow. It's a common extensor tendinitis. And in the golfer elbow, medial side pain at the elbow, it's a common flexure tendinitis. In wrist sprain, when you lift weight without activating your wrist muscles and forearm muscles, that time you suffer from sprain, wrist sprain. Hamstring strain, it's a hamstring muscles is strain when you want to take the sudden burst of excessive energy or excessive power, and your muscles is not able to handle that power, then these strain occurs. ACL and PCL tear occurs, and they are powerful ligaments, and they're very thick ligament, but due to very high force, these injuries occur in the acceleration and sudden twisting. Meniscal tear, it also occurs in the twisting injuries, and as you go grow older, these gradually the hydration of these menisci get less, and the chances of injuries increases. Ankle sprain, sudden movement of ankle or sudden twisting of the ankle causes ankle sprain. Now come the common causes of injuries. Unavoidable circumstances, like your sports is a contact sports, so some hockey stick can hurt you, or your opponent's foot can hurt your legs or your thighs, or sometimes intentionally they make scratches on your body part. So these are the unavoidable circumstances. Inadequate warm up, when you become so confident ki I don't require warm up, or you are in hurry and you just do 2 minutes warm up, and you start playing for continuously, then might be you got hurt. Overuse injuries are the injuries which uh, occur due to overuse, like supraspinatus injuries or rotator cuff tears. Improper gear, like you are wearing, your shoe size is 8 and you are wearing shoe size of 7, or you are wearing shoe of 9 number. You are playing with new racket, or you are not uh, you don't know what is the size or what is the length of your racket, and you start playing racket game without selection of proper racket. uh, Improper surfaces, like you shift from one surface to other surface, from clay coat to grass coat to synthetic coat, then these kind of injuries may occur. Wet outer fill and slippery surfaces, chances of increase injuries. Using wrong techniques, learning on their own or under not professionally qualified coaches, over or under training, lifting too much weight of your, you have just started your gym training or your strength training, and all of a sudden you started a very high weights, so there might be chances you hurt yourself. So what will be the treatment strategy? At the ground, rise, price, or police, whatever is available, you should use that. The rest, protection and optimum loading. Ice, icing, compression and elevation is always remains same in every treatment. And wherever you see a closed injury, or you should apply first ice, compress, and then elevate that body part. And the general principles of rehabilitation in upper limb and lower limb is: first, we have to achieve pain free range of motion, both first passive range of motion, then active range of motion, and then we have to proceed for the isometric strengthening of that body part. Then the isotonic strengthening. Isotonic means using some weight or some resistance band. And then we have to do proprioceptive training and game specific training. So in this module we have learned about various basic of upper and lower limb anatomy, types of injuries, common causes of injuries, and the primary treatment of injuries. So thank you very much.